health care has improved dramatically in recent decades due to medical advances and the growing recognition that women's health is more than body parts and involves a woman as a whole, her body, her mind, and her spirit. However, despite advances, significant health disparities continue to exist, especially for women of color. This has prompted many researchers, social advocates, and other health professionals to tackle the issues that cause disparities. One such expert, Sylvia Drew-Ivy, healthcare consultant and former CEO of the THE To Help Everyone Clinic, explains.
In the United States, health disparities are not the result of particular populations experiencing a set of illnesses different than the general population. Minorities and low-income populations experience higher rates of the same illnesses. We believe that if we pay attention to these differences, we can equalize the burden of disease within groups, if not eliminate problems for all.
Understanding how to reduce these health disparities requires knowledge of the root causes. Clearly, poverty is one of the key root causes. Antonia Hernandez, president and CEO of the California Community Foundation, elaborates on some of the other factors.
Access to quality health care goes beyond poverty. Gender plays an important role in the type and quality of care that women receive. Poor women are disproportionately employed in jobs that do not offer health care and health insurance. Moreover, many of these women are single mothers. Another factor is race. Women of color are more reluctant to share with their health providers their problems, and the medical profession is not well suited to understand the variations and problems in the health of women of color. In addition to that, you have the issue of immigration status. Many undocumented women are extremely reluctant to approach any public agency for fear of deportation. And as we know, housing is a very important factor in the quality of life. And poor women usually live in substandard housing and in housing that doesn't provide for an environment for a healthy family to raise their children. And of course, educational attainment. Women, and poor women particularly, do not have and do not achieve the level of education that affords them the jobs and employment necessary to live a middle-class life.
As we have heard, many factors influence health disparities. Dr. Kimlin Ashingiwa, director of the Center of Community Alliance for Research and Education at the City of Hope, helps us shed some more light on this topic.
Overwhelmingly, institutional factors, such as economic and healthcare systems, are the primary causes of health disparities. The Institute of Medicine reports that ethnic minorities receive inferior quality health care. The data shows that ethnic minorities not only experience high incidence of chronic disease, but suffer greater morbidity, such as pain and suffering, as well as early death due to chronic diseases. This is an indication of poorer care at the onset of the disease, as well as for their follow-up care. On the prevention-intervention front, studies show that when people are educated in a way that respects culture, as well as the socio-ecological context, such as access to parks and recreation, availability of low-cost fruits and vegetables, as well as a support system in place, that people can take control of their health and reduce their risk for chronic diseases.
In Los Angeles County, chronic disease accounts for 86% of the disease burden in women, and heart disease tops the list. Heart disease is the #1 killer of women in the United States and claims the lives of over 500,000 women each year. We spoke to cardiologist Dr. Deborah Judelson about this critical health issue. Dr. Judelson is a medical director of the Women's Heart Institute at the Cardiovascular Medical Group of Southern California.
Heart disease and stroke used to be thought of as a man's disease, but are very much a woman's health concern, responsible for more deaths than the next 5 diseases combined, and the major reason for disability. Since 90% of all risk factors are modifiable, reducing the impact of heart disease and stroke in our community is a matter of focusing policymakers and healthcare professionals on the root causes of disparities. I call these the ABCs of good health care. A, access, not just affordable health care, but also transportation, childcare, time off from work, and convenient location. Most important, education and services that are culturally and linguistically appropriate. B, body basics. Know your body and what you put in it. Low-cost, nutritious food, safe exercise location, and assistance in avoiding drugs and smoking. C, clinical care. Regular blood pressure, cholesterol, and blood sugar checks, and affordable treatment in a caring medical home are as important to a woman as breast exams and Pap tests for staying healthy.
Still, in the forefront of most women's health concerns are breast, ovarian, cervical, and gynecological cancers. New research and advances in early cancer detection and treatment are saving more lives, but serious health disparities continue to exist. We asked Dr. Marjorie Kagawa-Singer, a leading expert from the UCLA School of Public Health, is it because services are not available?
The services are often available, but they're not utilized. And this is an area in which of cultural competency, sort of the A's of cultural competency, it has to be first available, but it also has to be acceptable and affordable to women. So even when they're covered with low-cost mammography and Pap smears, women still do not go in. Many of these women are day workers. They get paid only if they work. They're losing what little pay they do have if they go in for screening because the waits are long. Often the services themselves are not done in a respectful way. So it's very discouraging for these women and very dehumanizing often to access the services. Then once they're diagnosed perhaps with an abnormal or an actual cancer, going that next step for treatment is also very intimidating. One, the word cancer is very frightening because for many of them in their life circumstances, the only people they knew with cancer died. So they feel it's a death sentence because of lack of education and seeing people who are survivors of breast cancer or cervical cancer. And this is the issue that we need to address for health disparities. How is it that we're going to bring these benefits of cancer therapy, early cancer detection and screening to all Americans?
With healthcare costs continuing to rise at an alarming rate, strategies for prevention are increasingly important in order to address the serious human, social, and economic consequences of chronic illness. Prevention can include screenings, health education, and the promotion of a healthy lifestyle and environment. Dr. Deanna Bonta, former director of the California Department of Health Services and currently Kaiser Permanente's Vice President of Public Affairs, talks about the importance of prevention.
We've seen that we've spent billions of dollars on treatment of disease, and so little funding is really targeted towards prevention. And yet we know research is showing, and we're seeing the results, that easy measures, I'm talking about good nutrition, exercise, reducing stress, never smoking, we're seeing that these are excellent prevention measures that can keep women from developing heart attacks, strokes, cancers, diabetes later on in life. And we're also seeing that low-income women and women of color are disproportionately at risk of developing chronic diseases, and that's why it's so much more crucial that these women come in for early diagnosis and treatment. We know that prevention works. We know that it is economically good for us in terms of a society and in terms of investing in our people.
As you've heard, a clean and safe environment, providing culturally competent, equitable health care, and promoting prevention are key to reducing health disparities. Dr. Juanita Watts, Southern California Kaiser Permanente's Regional Coordinator for Women's Health, provides us with some food for thought.
When I hear women say, "I never go to the doctor until I'm really sick," I wonder why. Many offer reasons of no child care, lack of transportation, or simply, "I cannot take another day off from work." I watch them struggle to afford the prescription medications, and even then, they have problems understanding what the doctor is saying. Little money and little time often force many women to put off that all too important visit to the doctor for another day. A woman's access to health care critically impacts their family's health, public health, and the economic workforces in our community. Women's health policy must address the root causes of healthcare disparities and needs for all women.